Hey everyone, Scott Lamb here from Muscle Activation San Jose, your kinesiotherapist. Well, in San Jose, California, it is a dreary day today, but we're in luck because today we're going to talk about shoulders, specifically the labral tear, labrum tear. The labrum is just basically this little gasket or the sac that kind of wraps around the shoulder joint and helps just keep everything protected in there. And if it ruptures, it can be really, really painful. So today what we're going to talk about is all the muscles that are associated with the shoulder and how they actually work. And then we're also going to go over the starting phase, phase one of rehabilitating this type of injury. Okay, so without further ado, let's get to the body.
Okay, so we're going to look really closely into the shoulder, but before we dive really deep into the shoulder, I want to take the time to kind of just show you that there's a lot of muscles that attach and feed into your shoulder when dealing with this labral tear, okay, the slap tear that's going on here, okay? So you can see the pec major ties in going into the humerus, which is the part, that's the main bone that makes up your arm for your shoulder. Then you have this deltoid. You also have this this neck muscle here that lays on top. Let's see. You also have the trap that comes across, attaching from the neck and the spine all the way into what's called the acromion, the scapula, and the clavicle, your collarbone, all which can control the shoulder and help out. Then if we go a little bit deeper, let's see. You can see here's the infraspinatus, here's the teres minor, here's teres major. It all attaches into the shoulder to help stabilize the joint. And here's the attachment point for the pec major. But then we can go even deeper. And you can see, so that right there, that's your scapula, okay? That bony attachment is the coracoid process of the scapula. And look at that, your pec minor attaches to that. So there's a lot more that attaches. Here's the rhomboid, or excuse me, this is the posterior serratus. I went too far. There it is. So here's your rhomboid minor, here's your rhomboid major, that's your levator. Here's your supraspinatus. Okay. Here's your posterior serratus. It's more of a respiratory muscle, but it does have the ability to help shift around and stabilize the shoulder. Right here, can't tell really well with these images that I have, but that right here is your anterior serratus, and it actually attaches. Let's see how far I can go. Right there. Okay, that's your serratus anterior. It actually attaches also to your shoulder blade. Okay, now the important thing about the shoulder blade being able to move and rotate and everything, and then when talking about this tear specifically, it's right up in here. Okay, there's this like gasket. That's your labrum, and just like a gasket for a vehicle, right? If there's a rupture or tear in it, then you have problems. Same thing with the human body, okay? It's supposed to be this kind of like a gasket for your arm to just be a good barrier and soft tissue. But if it ruptures, then it's painful. We have a lot of problems with that. And it takes some time and commitment in order for it to heal and strengthen properly. But the main reason why you have this damage is because the muscles stop doing their job properly. And this all happens because of muscular imbalances. We create this compensation in order to keep on moving and doing things. And these compensations get stronger. And then we start having these imbalances where we start having tightness and then or pain. All right. The only other way that this happens is if there was an actual accident or injury. Car accident, sporting accident, something like that might have caused it. Okay, so now let's go look at the actual arm a little bit more closely. Okay, so here we are having a close look at the actual arm and all the muscles that are associated specific with the arm that we're going to be working on to try to help strengthen the body. Now, usually the cause, again, is that the muscles have given out or something's just not working properly. And there could be a million reasons why. There could be core reasons. There could be direct shoulder reasons. And so that's how come I actually recommend people to get assessed. You have to get assessed appropriately and have a personalized plan. What we're going to be going over eventually is what's the normal progression on helping people. But again, there's a million reasons what can cause, because the whole body is an integrated system. As you can see before in the previous images that I showed you with the body tying into the shoulders, that was a specific look at the trunk and spine and how the trunk and spine can actually tie into the shoulder and provide support and help. So if there's something wrong with the trunk and spine, that can tie into causing problems in the shoulder. And no matter what, if there is some type of an issue, there is some type of issue going on with the trunk and spine. So to inform you, if you go to my website, here's my website, you can go and click on to start the program, posture exercise program sign up, click on purchase, and then right here you can purchase for $50, having me assess you and then write you a prescription to be able to help give you the relief that you're looking for. This isn't a bot. This isn't some cookie cutter program. This is a detailed prescription plan just for you based off of the assessment that you send me. And I give you instructions and details of how to do that. It's with a HIPAA compliant app. That way your privacy is completely protected. It's highly secured, and we'll take care of you and get you on the road to feeling better. Okay? Well, let's go back to those muscles. So in this program, we're going to be talking mostly about the shoulders because that's the first place that you want to work with truthfully, even though there could be some underlying features. So these are the big muscles. We call them global. Okay, this deltoid right here, that's a global muscle. All right, but then if we go down a layer, all right, here are local muscles. These are your rotator cuff muscles. Okay, so the supraspinatus, the infraspinatus, teres minor, teres major. Let's see, and then the subscapularis. Then the bicep brachii. That acts as a rotator cuff, even though it's more of a bicep muscle, because can you see how the ligaments come, or the tendon comes in and attaches into the same area right in here. Okay, then here's your coracobrachialis. That's a bicep muscle also, but it attaches right in here. All these muscles, including these tricep muscles, right, here's the long head. It comes in and attaches and helps stabilize the shoulder. So these are all the muscles that we're going to be talking about and working with, trying to influence them, strengthen them, getting them activated and doing what they're supposed to be doing. Okay? So without further ado, let's head to the workout. Okay, here are 8 specific exercises. That is the beginning process of providing the relief necessary in order to heal from the labrum tear. This is something that should be done 2 to 4 weeks. Generally, I say go longer than shorter. During these movement exercises that we're going to go over, you're going to feel discomfort and pain. When it's time to progress is when you're no longer having discomfort or pain while doing these exercises. So it can be shorter, it can be longer. Okay, I've seen this process take 3 months before to help people out. Okay, so the first one, the pendulum swing, pendulum exercise. Okay, so it's very simple. A lot of people have seen this, probably done at the gym or at home or anything. You want to have a straight spine. You want to get yourself good support. You want to think about bracing your core, okay, making sure that you're not putting any stress on your back, your hips, your legs. Make sure your hip width apart so you're not leaning anywhere or anything like that. Then it's very simple. You're bent over, hanging. In the very beginning, you might want to use 0 weights, okay? But you can try like a pound, but you're really not going to want to go further than 5 pounds. As you can see right here, it's in this description I have, okay? So you might want to go body weight. The whole point of this is just relaxing and trying to get the really deep local muscles. Remember when I talked about those pictures? You had the global muscles, which is like the deltoid. Then in the previous screen, you had the pec major. You had the trap, Those were global muscles, okay? We're trying to influence and stabilize and strengthen these local muscles, but the only way we can do that first is by getting them activated. And that's when we're trying to do very gentle movements. You gotta do really light, very simple. Try to relax the shoulder as best you can, kind of like letting gravity win. That's how come it's important that you don't overstress it, because again, these are local muscles, and if you use too heavy of weight, then those global muscles are going to take over because they're really strong, right? Your shoulders, your pec, your traps, they're really strong, and your body's going to use whatever it needs to in order to continue moving with the stress that you're putting onto it, okay? So you want to go really, really light so that we're making sure that we're accessing these local muscles that are really small and really fine and get them moving, all right? So maybe body weight only, maybe 1 pound, but no more than 5 pounds, okay? You can even use like a can of beans or something like that if you want to do this at home. So it's very simple. You have it resting, whatever is that resting neutral position for you, and then very gently you just start very small movements, okay? Not big movements. This is excessive, okay? This is a big movement. This is someone that's experienced and not having any problems, okay? Good model, but very small movements, okay? Just going up and down, or forward and back, excuse me. Forward and back for the time that's been prescribed, okay? Then, once you finish that, then you're going to try to go left to right, side to side, okay, for the same amount of time prescribed. And that would be 1 set doing those, okay? Let's watch a video to see how it's demonstrated doing. So, see, rocking the body, causing it to move. Okay, that's a little aggressive for just starting out at the very end. Then, side to side. Very simple, trying to relax the body, causing the movement. We can even add circles if you want to, but that's a little bit more advanced, reversing the circles. The very first thing you should start with is forward and back, side to side. And then once that gets easier, you can add the circles. Okay? Let's check out the next one. Assisted flexion to 180, okay? Now, this is the end goal right here. This doesn't mean this is where you have to get to when you first start. Again, this can take 2 weeks to get to this point and be pain-free and everything, or like slight discomfort, but it could also take 3 months, all right? The guesstimation is 2 to 4 weeks. So you get a dowel or a broomstick or anything that you have that's available. Now, this arm that's on top right here, that's on top of the dowel right here, that is the active arm. This is the inactive arm. It's there to kind of like just help and be support, okay? So first lay down, be comfortable, no pain in the neck, in the back, or anything like that. Add pillows if you need to. And then you're going to start, and then you're going to reach with this arm back. And then this opposite arm that's holding the dowel right here, it's going to, once you get to whatever your end range is, it's going to gently push and assist. Now, what's really important is that you're really not trying to use your body, okay? You want to kind of like really separate your body from your arm. You want to imagine that your body is totally separate, it's disconnected, you're not doing anything, you're not trying to use your back by arching or lifting your hips up or doing something with your neck. You want to try to kind of like really detach your body from your arm, okay? And then help with that movement. Let's watch a video. So gently lifting up with the focus of this shoulder, separating the whole body from the arm. And then at the very end, where that end range is, doing a little assisted, a little turbo boost, okay? But it's very gentle. I mean, only like maybe 5 pounds of force, okay? Not very much force at all. Okay, the whole point is trying to increase the range of motion. Maybe hold it for like a 2 count up top when you get to that end range. That would be good. Okay, let's go to the next exercise. Bilateral shoulder flexion. Up to, what would be better is up to 180 degrees. So this is kind of like a 90-degree motion here, and then this will be 180, bringing it all the way back. So again, the same thing as before, being in a comfortable position. You don't want any stress in your back or your neck or shoulders or anything yet. Coming to this neutral position. And then with this dowel, What can help a little bit that's not listed here, just a little side tip, is by applying force like you're trying to separate, okay? Not a ton of force, just a little like muscle tug, okay? Doing that's going to activate these shoulder muscles a little bit more and try to get some more assistance and isolation in your arms, taking your body out of it a little bit, okay? But again, very gentle, like less than 5 pounds, like a pound, like just a light, gentle force. If that hurts though, don't do it. And again, you want to try to separate your body from your shoulders and your arms. And you really want to think about reaching back. Now, only go as far back. You want to have like at most, dull ache. If you have a sharp shooting pain in any of these movements, you're going way too far, way too fast. Okay, nice and controlled and slow. So at most, a dull ache is okay. But you want to reach back as far as you can, hold it for a couple of seconds. No more than 6 is necessary once you get to the end range, really thinking about trying to keep it and flexing those muscles to get to that back position, and then coming back to a neutral position. Let's check out the video to see how it's done. Nice and easy. See, noticing the body is staying really still. Very still body, and only the shoulders are moving. And that's the focus, okay? You want to really focus on thinking about having your body detached from your shoulders and only working these shoulders with this movement exercise. Okay. Okay, so this is similar to the previous exercise, but it is more of an angle outward. Okay, so the first one was more straight back. This next one is kind of like, this is like an I, and this is like a Y type of motion, okay? But essentially, it's the exact same thing. So the dowel is going to be on the opposite side, and then this is the hand that's just assisting. This is the active arm, still in a comfortable, relaxed position, really focusing on keeping your arm separate from your body, and then same kind of thing, reaching out into a Y position, and then using this dowel as a little bit of a turbo boost to help push it a little bit further. Again, at most, dull ache is all that you're going to feel. Let's watch a video to see how it works. Perfect. So this is the end range goal. This isn't what you are expected to get in the very beginning. In the beginning, it's going to be very difficult. It's not going to feel good. If you're going to a sharp shooting pain position, you're going too far or you're going too fast. At most, you want to have a dull, achy feeling. Dull ache is okay, but if it starts to get worse or it starts to inflame, then you've done too much, okay? All right. Next exercise. All right, external rotation. So this is where we're getting into more of those rotator cuff muscles, all right? Now, ideally, you're going to want to have your elbow at 90 degrees right underneath your shoulder, right next to the rib cage and everything. But as your arm moves out, as you rotate your arm out, the elbow can separate a little bit. That's okay. Really try not to force it to stay in. Just let the arm move where it wants to. Just don't think about trying to push your elbow out, okay? Just keep it just resting in, and wherever it goes to, if it goes away from your rib cage a little bit, that's okay. Don't worry about that. So just like the other ones, when on separate your body from the arm, and the focus is just trying to move this arm. This is here to assist. This isn't the main focus, okay? This isn't what's pushing and getting it out there. We're not trying to like stretch it out there. This is here to just assist you rotating this arm out to however far you can get it out there, okay? So you're going to rotate it out yourself with your own strength, and then once you get to that end range where it's a little dull, achy, you're going to apply a little booster, but still trying to use these muscles on the back of your shoulder blade and your shoulder to try to get that movement, okay? Let's watch that video. Nice and gentle. You can see how I'm talking about how the elbow kind of goes away from the rib cage a little bit. It's not a big deal. It's just moving appropriately in the pendulum, okay? Focusing on the back of the shoulder blade, the back of the shoulder here, causing that arm to rotate. If you're feeling your tricep, feeling your bicep, you're pushing too hard or you're going too far, okay? That means that those global assister muscles are trying to do the work as opposed to these local stabilizer muscles that we're trying to focus on. Okay. So we did external rotation. Now we're going to do internal rotation. It helps that see this arm right here where the hand is, we call it a closed position, okay? Where your thumb is in towards the midline of your body. That causes internal rotation of your forearm, which then also promotes internal rotation for your humerus, okay? And so we're focusing on, look at that, internal rotation. So this one, instead of this arm pushing, this arm will be pulling out this direction, okay? But first, with your own strength here. You really want to think about this muscle that lays on the front of your shoulder blade, that's in between your shoulder blade and your rib cage. So it's going to feel more like an armpit muscle to the front of the deltoid. That's where it attaches to, if you can remember. So you want to really think about trying to pull the arm across and then use this opposite arm. With this arm, you're pushing across, feeling the armpit muscle to the front of your deltoid, your shoulder area. That's where it attaches to. And then when you can't go any further, this arm is to do a little bit of extra pulling and boosting, okay? So this is where it might be a little sensitive on this one, right? Yeah, let's watch the video now. So nice and gentle, then a little extra tug right there. Again, at most a dull, achy feeling. Hopefully it's a strengthening feeling. Very gentle, holding it for a couple seconds at the very end, really focusing on that armpit rotator cuff muscle doing a lot of the work. If you're feeling your bicep or your forearm doing a lot of work, then you're either pushing too hard or you're in a bad position. So just try to adjust maybe the elbow out a little wider than right into the rib cage. That'll make more room for you. What's important is that you're not sliding your arm into your body. And then you'll be able to focus a little bit more on those rotator cuff muscles. Okay. Okay, so a lot of people I've seen do this one on the wall, which is great, but it's a lot better to do this first seated and kind of like working with gravity instead of going against gravity, okay? So it's very simple and very easy. This is just core engagement and just trying to push and just stretch as far as you can. Now, if you can get your body to go really low, that's great. Then you're probably ready to go for the wall, okay? But you're going to bend forward and stretch and try to push this shoulder past your ear is what your goal is. Now, you might not get your arm all the way straight, and that's okay. In the very beginning, I mean, it's going to be difficult, okay? But really focus on this shoulder, kind of like pulling it up towards that ear, all right? And then just be careful you're not dropping your head too far. You want to try to keep it in line with the rest of your spine here. Very simple and gentle movement. At most, you want to feel a dull, achy sensation. You don't want to feel a sharp shooting pain in any of these motions. Let's go see the video and see what it looks like. So nice and easy, reaching the arm first, and then bringing the body down as far as you comfortably can go. And then pulling back, really trying to be active in all the movement here, okay? Now notice there's a little dip here on the side. We're leaning to the right a little bit. Really try to be conscious on that. Try not to do that, all right? Really focus on trying to keep your body straight in the middle as best as you can, okay? Last but not least, the shoulder shrug. Okay, so you'll see it a little clearer. This is kind of like a bad image right here. But when it comes to this one, okay, shoulders are relaxed, nice, good posture, no pain. Now, you shouldn't feel any tightness in your back or anything like that, okay? This is one of those global muscles that we talked about before for the traps and everything, right? Again, it attaches from the base of the thoracic spine, like right around here, all the way up into the neck and into the base of the skull here. And then it attaches across right through here. So the end of where it attaches right here. So what you want, and then it attaches right back here on top of the skull, down the neck here. Okay, so you want to think about trying to bring this point of your shoulders towards your ears. Now, if you look at this image, it just looks like it's coming straight up, okay? It will come straight up at first, but the idea is proper progression, right? The muscles get shorter, right? And so the attachment point is up here and the attachment point's right here. So in order for it to get shorter, this end point of the tissue here has to get to the end point of the tissue here. Okay, does that make sense? You'll be able to see it a little bit clearer when we watch the video. Let's check it out. So coming up, but then you see at the very top, it kind of pulls inward, pulls inward towards that ear. So that's the focus. You won't want to think about coming straight up. You want to think about coming in towards the ear. Okay? Very simple, very gentle. If at most you want to feel a dull ache, if you're feeling sharp shooting pain, then it's too aggressive, too far. Okay? Now all these exercises are to be done daily. Every single one of these exercises, you need to do 3 sets. Try to do 10 repetitions of each. Again, a whole set with the pendulum swing is forward and back, side to side. If you feel okay and you feel like you can do more, you can add the circles to one side and the circles to the other side. So it would be 10 forward, 10 side to side, 10 circles one way, like clockwise, and then counterclockwise, and then that's one set. All right, then give yourself roughly 30 seconds. I mean, as long as you feel like you're giving your body some rest, that's all that really matters, okay? But the rest of these, roughly 30 seconds, give or take what feels good for you. 10 repetitions. Try to hold it for a couple seconds at the end range with these mobility ones, all the way through here, a couple seconds here also, and then 3 sets. And then this is stuff that you should be doing daily. Can you do too many? Absolutely. Okay, if you do 1 set and on the second set and it feels fine, and you have like dull achy, but then on the second set you start having sharp shooting pains, that's too many. Okay, so just do 1 set for a week. See if on the second week you can do 2 sets. If it's the same thing, then you're still just doing 1 set, okay? But if you're able to do 2 sets, then great. Do 2 sets, then try to test to see if you can do a third. If that's a little achy or painful, excuse me, if that's sharp shooting pain, then go to just 2 sets for 1 week and then progress and try to see if you can do a third set the third week. Basically, you want to be able to do all 3 sets, every single movement, full repetitions with at most dull, achy feeling. No sharp shooting pain. If the sharp shooting pain, then you need to you've reached your maximum limit. Okay, and as long as you can do it solid for a whole week, you can progress to the next series of sets or exercise or reps. Even like if it turns out that only 5 reps is all you can do without having sharp shooting pain, then just do 5 reps. Okay, these are just goals. These aren't have-tos. All right.
Well, that's it. That's all that we have for you today. So those are all the exercises, the mobility exercise specifically to try to activate and get the muscles that should be stabilizing the shoulder better to actually do their job, so it takes away some stress. So the whole point is that the muscles are designed to decompress the joints. If you're having compression in joints, which is the only way that you're going to be able to have this type of injury to the body, then that means the muscles aren't doing their job well enough. There's an imbalance going on. There's a muscular imbalance and certain muscles overworking while other muscles are not working enough. So you got to get the right muscles stronger to do this job and decompress that shoulder. All right? So thanks a lot for making it to the very end. And I look forward to talking to you again soon.